This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo. Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hi, little man. Are you keeping him?
Yeah, this is the
Oh,
pick of the
my.
litter. This is the pick of the litter.
Oh my God, he is fabulous. Hi, little man. Hi, this is your first TV show. Look at him. Hi. Hi. He's a smart one. Look how smart he is. Oh, are you cute?
We had a big morning this morning. We went out. We were retriever training with all the big dogs today.
Ooh.
Yeah, so he's
Probably going to sleep now.
That is certainly the hope.
Well, listen, if anyone wants to know about how cute this dog is owned by Dr. Rance Gamblin, our favorite veterinary oncologist and new associate professor at Mississippi State University College of Veterinary Medicine. Yay! Welcome, Rance. Thanks for coming back on the show.
Thank you.
We want to talk to Dr. Gamblin today. And by the way, my co-host, Janet, is off somewhere. She apologizes. She needed a note for it to be excused. But we want to talk to Dr. Gamblin today. With so much cancer going on with our pets, are there any blood tests like a serum profile or what shows up in a CBC? What can we do preventatively? Like that little guy that you had in there. What are your plans for him, Rance, to keep him healthy?
Well, I mean, obviously, I think the best thing is to have a good relationship with your primary care veterinarian, and following their recommendations. A lot of the stuff, quite honestly, on the referral side, I think that sometimes the primary care veterinarians maybe sometimes hear about that stuff before we even do. Quite honestly, I certainly feel like it's a good idea even on your younger dogs, probably having complete labs and that type of thing checked on these guys, at least probably once a year or so as they're younger, and then maybe bumping that up to maybe even every 6 months, as they get to be, kind of their prime of life, and then on into other geriatric years. So I think just routine monitoring of complete blood count, chemistry panels, urinalysis, thyroid, that type of stuff is a very good idea. There certainly are some new diagnostic blood tests that are being out there that are touted by some of the laboratories as being cancer screening tests and that type of thing, which a lot of those were kind of coming out about the time that I was retiring. I don't necessarily have a lot of experience with them myself as far as being able to tell you exactly how I feel about them. But I think that they certainly are. I hope that they are going to end up having a place as being able to non-invasively screen these guys over time.
That's how I feel too. The little bit I've read about those, I'm kind of thinking it's kind of like when color TV first came out.
Right.
I'm waiting for the perfection of it. And having said that, as a nervous and OCD pet owner and a veterinarian, I mean, I can run blood work anytime I want. And I've got this 3 and 4-year-old. So, I did blood work, their rescues as soon as I got them. I do it now every year. But when they get a few years older, they're going to have it every 6 months. And
I think it's a good idea.
Yeah, don't you agree?
Yeah, I do. And quite honestly, I think sometimes it comes down to just being able to look at that laboratory work and really interpret it. And certainly that's not necessarily something that we expect an owner to be able to do. But
Right.
I think it's important to look at trends, to look at to really look at the values. Just because it's not flagged as being abnormal doesn't mean that you may not glean some information that may help you head off a problem. If you're seeing that your dog's red cell count is slowly ticking downward, or our calcium, certainly if that's starting to slowly tick up, those types of things that, you, at the very least, it doesn't mean that you do have a problem, but at the very least, it
Hmm.
should be an indication that maybe this is something we should be watching more closely. And is this an anomalous lab value, or is this actually a real abnormality that we need to be concerned about?
Yeah, I agree with you about the trends. And the other thing, too, that I've never failed to be amazed, sadly, is I can have a dog here, right here, with normal blood work that has cancer, has a big tumor somewhere. And so it's the complete blood counter, what we call CBC, and serum profile, which is potassium, sodium, kidney, liver. It tells us stuff, but doesn't tell us everything.
No, and in fact, that always was a very, very common conversation that I would have with clients in the exam room is that, they can't believe that their dog has cancer because, they just had laboratory work done, 3 weeks ago or a week ago, and their laboratory work's all normal, so they can't have cancer. And I'm going, "Well, that's,
Mm.
I think I've even said this before, quite honestly, if my patient is not doing well and their laboratory work is normal, I'm actually more concerned about cancer.
Yeah, good
You know,
point. Yeah.
I've actually become more concerned about it because I'm sitting there going, we don't have a, while certainly finding problems like with kidney disease or liver disease or whatever else, while that's not something that you necessarily want to find,
Mm-hmm.
it at least answers the question of why
Mm-hmm.
are we having problems. But everything is kind of down the line normal, my index of suspicion goes up rather than down. I guess is the best way to put it.
And I also think anything out of the norm for that pet, they're creatures of habit. And I remember I adopted from Golden Treasures at age 11 a golden retriever, Cindy, and she was a great walker. And we walked Hinkley Lake almost every day. And I remember about 3 years later, she just didn't want to walk. We got out of the
Right.
car. She just stood there, and everything else seemed to. She ended up having a brain tumor. So
Right.
you can have such subtle signs. I would have never attributed not wanting to walk to a brain tumor, but the moral of the story was it was something different from her regular routine, and I think that is a red flag for all of us with
For
pets.
sure. And clients are typically are very in tune with their pets, and so if I had a client telling me that they're just not right, there's
Yeah.
something not right here, I'm inclined to believe them.
Oh, absolutely.
I'm inclined to believe them. It does not necessarily mean that my job just got easier.
Hmm.
You know, but at the very least, maybe the things that they're telling maybe gives me some direction as far as what should be the next things that we start to look at, to help us maybe narrow down where that problem really lies.
And I think something you and I have in common is if there's a skin bump, lump, or mass, it needs to be aspirated, meaning a needle, it doesn't even hurt, stick it in there, suck some of the cells out. That's not a biopsy, it's called a cytology or an aspirate. You got to find out what that is.
Oh, for sure. I agree. I agree for sure. The uh, looking at every one of those little lumps and bumps is probably not a bad idea, and just making sure that you aren't dealing with a problem. Um, and I actually had to laugh. I was actually at a hunt test this past weekend, and my veterinary kit, as you might imagine, is a little bit different than most people's. And I'm getting called over to like look at friends' dogs, saying, "Hey, what do you think about this lump or whatever else?" I've got like a slide case in my truck right now that I need to drop by the metro and stain it and go look at it,
Yeah,
so I
yeah,
can so
yeah.
I can tell what's going on. I'm doing it on the tailgate of a truck.
Right, right. I met a fellow dog walker at the park, and he had a golden and another breed, and their heads were sticking out the back window. And I said, "Oh, they're so cute." And I'm petting, and I felt this lump, and I said, "Well, how long's that been there?" And I said, "You need to have that aspirated." "Yeah, I was going to do that." I said, "Okay, when are you going to be here next?" You're right. I did it in the trunk of my car. I brought the aspirate, and I said, "What's your phone number? I'm going to take it home and stain it and call you." Yeah, no charge.
Exactly, exactly.
Yeah, yeah.
I was telling somebody I did more. I think I did more veterinary medicine this past weekend than I've had since
Oh,
I retired. Yeah, I'm actually going to have to restock my medical bag with a wide variety of items after doing that little test this
hey,
week.
let me tell you, you can get a personal account with MWI if you already haven't done that.
Oh, I have not done that. Maybe I
Yes,
need
I
to.
have one. That way I can buy microscope slides and heartworm preventative and all that stuff. So make sure you do that. Just a little retiree to retiree
Yeah,
info.
get with me later.
Yeah, I will.
Yeah.
Now, I want to talk about specific skin tumors. Like, okay, let's start with melanoma.
hmm
For example, melanoma, where on the body should I be most concerned or everywhere? And what breeds do you think you see it the most in?
All very good questions. I mean, the as far as sites, my general rule has always been is that if it's on haired skin, I am a lot less concerned. Um,
Okay.
it seemed like just seeing a lot of melanomas in practice. Maybe about once or twice a year, I would have a haired skin melanoma that I was actually concerned about from a biopsy
Oh,
standpoint.
okay.
Most of the time, those were biologically pretty benign.
So you,
Uh,
those surgically are taken off then?
Right, yeah, surgically taken off, that type of thing, and you get your biopsies back. There are special stains and stuff that the pathologist will go through and like look at things like proliferation indices and mitotic count and all that business. That kind of gives you an idea of, is this a fairly benign melanoma, or is this one that should be more concerned about? And thankfully, most of the time, if it is haired skin, they usually are pretty biologically benign.
Okay.
But where I start to become a lot more concerned is when I start seeing them arise on mucous membranes, or where haired skin meets mucous membranes. And certainly the number one site would be the mouth.
Oh, that's bad. Okay.
Anywhere around the mouth, in or around the mouth, those are the ones that I worry a lot more about. And it seems like really just about any location, whether that's the gingival tissue, the tongue, the roof
Mm,
of the mouth, the tonsil, the inside of the cheek,
mm.
or even the lip margins. Those guys, I'm a lot more worried about. Probably right behind those would be nail beds.
Oh,
Um, Nail beds are a big one, and foot pads.
okay.
Yeah, nail beds, foot pads, and then probably kind of farther down the list would be like the perianal ones, that type of thing. Those tend to be a lot less common, but that dog whose nail flakes off,
Yeah.
and then the nail just doesn't, it starts to grow an abnormal nail, or the nail doesn't regrow, or whatever else. My index of suspicion of whether that's a melanoma or some other tumor of the nail bed, goes way up.
Are they always black, these
They
melanomas?
they aren't. In fact, actually, some papers would suggest that somewhere in the neighborhood of about a quarter, so 25% or so of melanomas have a very specific mutation where they don't make melanin.
Okay.
And so, or make very little
Okay.
melanin. And so those guys may actually appear pink,
Hmm.
that type of thing, and so not be black or purple at all.
Hmm.
Um, so the color does not necessarily point you in the right direction, but certainly the black purple kind of classic mass in the mouth or the lip or whatever, you can pretty much bet those are melanomas. But when you see those pink ones, it doesn't mean it's not, for sure.
You know what's sad about an oral lesion is nobody really looks in their pet's mouth.
Yeah, with the advent of dentistry,
Hmm.
and how prevalent, doing dentals and dental cleaning and all that stuff has become, I think we spend more time in their mouths now than we used to, for
Which
certain.
is good. Yeah.
Absolutely, I think it's a great thing, and I think that is probably as good of a rationalization for doing routine dentals or regular dentals on your dog as much as anything, is
Hmm.
just being able to get a good oral and even pharyngeal exam, um, and certainly if you see something, biopsy it.
Boy, the tonsil. When you mentioned tonsil, I totally forgot about that. And I had my girlfriend in New Jersey had a little rescue Sheltie, and the dog just wasn't eating well. And not eating well, odor from the mouth, salivation. We had a feral cat as our office cat. I adopted it because I knew it wouldn't make a good pet. And I went upstairs and I said to Jackie, "How come little Jerry's not eating? Or what's all this canned food sprayed all over the walls?" He ended up having a big tumor in his mouth, but we had to sedate him to see it. So anything different around the mouth needs to be checked out.
For
Odor,
sure, yeah,
yeah.
it's one of the most common sites, of
Mm.
malignancies in dogs. Period. So certainly paying close attention to their breath and that type of thing. Everybody just kind of assumes that if they've got bad breath that they need a dental cleaning, but and a lot of times that's all it is.
Yeah, thank God. Yeah.
But yeah, but that's it really is. Your nose tells you a lot of things,
Yeah.
and when you're kind of getting that smell that will roll up wallpaper,
Yeah.
there's
And
there's a reason for it.
and again, change of habit. Doesn't want to eat well. That kind of thing. Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
I was going to ask you too about the melanoma vaccine because you and I had a client together. It was a honey-colored chow that would see me for derm reasons and saw you for its. And I think that dog was like 2 years out. With using the
Right.
vaccine, if I'm not mistaken.
Right. And the melanoma vaccines, has been around, gosh, now for probably 20 plus years.
Oh.
And it's a really interesting and unique product. And I guess my experience with it, having vaccinated, gosh, hundreds of dogs probably at this stage of the game. And most people, when they think about a vaccine, they think about something that is a preventative. This is truly as a therapeutic and not and not a preventative. But I guess as I used to tell clients, how I would sum up my experience with the melanoma vaccine is pretty easy. Kind of one sentence. Nothing works for everybody. Is maybe the best way to put it. Because I have certainly had dogs that I would have said were ideal vaccine candidates. They
Okay.
had relatively small melanoma. They staged negative everywhere that we looked, couldn't find any evidence of spread, and their tumor was completely removed surgically. And then we followed them with vaccine. And they developed metastatic disease and died within 6 to 9 months.
Oh.
But by the same token, I would have these dogs that really shouldn't have done well, that were kind of like what you were describing here, where they're getting like their 2-year melanoma vaccine booster, that type of stuff, and you're like going pretty phenomenal, and the only thing that we were doing therapeutically for them was the vaccine. So it's really, they were dogs who probably should have passed away within 6 to 9 months that didn't.
Do you
So
use the vaccine when it's a small growth, or do you use it after you take like the big tumor out and then after that? Or
the answer is yes.
both of them?
It seems like the indications for using the vaccine, the ideal indications, I would say, is if you have good local control, so you've done surgery, you've got clean excision, You don't have any obvious evidence of metastatic disease, so you don't
Okay.
have any obvious evidence of spread, that type of thing. That's kind of your ideal situation because we know that the vaccine will take somewhere in the neighborhood of anywhere from 2 to 4 months before you really see maximal immune response.
Okay.
And so that's why these dogs that come in with kind of more advanced disease, that we doesn't mean that you can't vaccinate them. It just means that we're now trying to play immunologic catch up
Yeah.
in terms of treating. I always kind of caution people that said that doesn't necessarily mean the vaccine's not working. It just means that we're maybe getting into the game late.
Yeah. Oh,
So,
that's a shame to hear.
but yeah, so it's but we try to use it in the we try to use it as best we can in the post-operative setting. There's one paper out there that did talk about the importance of clean margins, and it was kind of interesting. There were dogs that had all of their gross tumor removed, so they had no visible tumor, but they were not necessarily microscopically clean excisions, and they actually still had better than expected outcomes when following them with vaccine. Now, I always just kind of caution people that it was a relatively low number of cases, and so I don't know if those stats would bear themselves out in bigger studies, et cetera. But sometimes you just because of the nature of where those tumors want to grow in the mouth, sometimes it may be very difficult or very disfiguring or whatever else to be able to get a clean excision because of the location of the primary tumor.
Yeah.
But that does not necessarily mean that surgery isn't indicated. You may be able to do a really good taking it down to minimal disease. Maybe and then following the vaccine. You just realize that you're just kind of taking a little bit of a gamble.
Where does it metastasize in dogs when they have melanoma?
It seems like melanomas are kind of weird from the standpoint that they can kind of do whatever they want to do. They can kind of do whatever they want to do, but the ones that kind of obey the rules, it seems like lymph nodes usually are your first. So for most of our oral lesions, we think about like those submandibular lymph nodes, so here at the base of the base of the jaw.
Yeah.
But deep pharyngeal lymph nodes or deep cervical lymph nodes, so kind of back here, kind of close to the larynx, et cetera. Tonsil definitely is a big one, depending on location. And then from there, usually your next step usually is lungs. But melanomas, like I say, are kind of oddballs from the standpoint that they can kind of do whatever. I've seen all kinds of unusual sites of metastatic disease with those guys. So things like bones, central nervous system, thyroid, spleen, kind of you name it. Cats are fairly notorious. Cats don't get melanomas nearly as frequently as dogs do. I mean, it's probably one of the few things that where dogs may actually kind of outrank cats in terms of a malignancy. But
Where do cats get them on their body?
well, they kind of get them in a lot of the same places.
Oh,
But as far as sites of metastasis, one of the weird things is a lot of times cats get it in. A lot of times we'll actually get more like abdominal metastasis, so like spleen, liver, that type of thing, as opposed to pulmonary. But they certainly get that too, So.
We just had today, Dr. Karen Trainer, the pathologist, was on. Her episode dropped, and she was telling us she biopsied a cat that had a lesion here, a bump,
Right.
and another one here. Well, this one turned out to be a papilloma. This was a meningioma.
Really? So going right up
Yes,
the almost
right
line.
there. And she said, I couldn't believe it. She said, I phoned a friend, many of them, for them to look at it. And they were all, Thelma Lee Gross looked at it, Dr. Gross, and said, those are meningioma cells. Never bothered the cat. They thought that during the development of the cat, a couple of those cells kind of broke through. I mean, who knew?
Wow, that's crazy.
Yeah.
That is truly crazy.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon base for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So tell me about, I know I emailed you about this. What's the new thing they're using in squamous cell?
The new thing that they're using in squamous.
Was it an
Oh, I remember you sent me that article, and now I'm
Yeah,
trying to
what was
remember what it
that?
was. So, gosh, I want to say that it was one of the small molecule inhibitors. I mean, it may have been like trametinib or one of
Yeah,
those.
I think it
I
was.
believe you're right.
Yeah,
I believe
yeah.
you're right. I'm going to have to go back and pull that now because it's going to bother me.
Oh, I'm sorry.
But that's okay.
But
That's
the
okay.
reason I'm asked about squamous cell, because our little Jerry the cat had one. And there again, it was this huge mass in his mouth that we couldn't look in his mouth because he was feral. But there's not much, and that just kind of stays in that area, correct?
Yeah, that to me that is a very interesting difference in dogs and cats is squamous cell carcinomas in most dogs you can usually fix with surgery.
Okay.
Every long once in a while you will deal with one that spreads. In dogs tend to tolerate aggressive or fairly radical oral
Yeah.
surgeries really, really well. Cats, on the other hand, it seems like the squames that they get in their mouth, whether that be under the tongue or associated with the mandible or whatever, just tend to be just crazy aggressive in terms of local destruction.
Yeah.
In thinking about it, I can't say for sure that I can ever really remember seeing a cat who had spread of an oral squamous cell carcinoma, but they all uniformly died of local disease, almost regardless of what we did, whether that was surgery or radiation or whatever else. And it just seems like cats, it's just so much more of a crapshoot in terms of how well they tolerate those big oral surgeries. Taking a quarter of a half of a jaw.
Yeah, there's not much of an oral cavity in a cat when you think
There isn't,
Yeah.
but even
Unless you
still,
get bit.
yeah, exactly. And then there's plenty of it in there. Yeah, and usually with like the worst teeth in the world,
I know.
sunk into the meat of your thumb. But no, even some some of these dogs that have such short jaws and whatever else, they still figure out just kind of how to deal with having very little jaw left post-operatively. And so many cats, it just seems like, I used to have the conversation with clients that you probably, if you're really seriously considering an aggressive oral surgery in a cat, you really probably in the back of your mind need to be prepared for and dedicated to some type of long-term interventional feeding.
Oh, yeah. Yeah.
Like, an E-tube or a gastrotomy tube or something along those lines, because so many of those cats just, they just don't eat again. And that's why, Steve Withrow, basically the father of veterinary oncology, as far as I'm concerned, his always comment was that was the bane of veterinary oncology.
Oh, I bet.
Was oral squamous cell carcinomas in cats, so.
The bane of mine is mycosis fungoides.
Oh, yeah, there's another fun
In
disease.
lymphoma. I mean, there is no good treatment for that. And yet in humans, they're like, oh, CTCL, oh, here, put a little steroid ointment on it, or go for light therapy. And in dogs, they can be dead in 3 months. It's just absolutely horrible.
Yeah, gosh, Dr. Elpiner and I have had that conversation over and over and over again. You know, it's just like that's another one of those diseases that's just so frustrating to deal with, and how I manage them. And like I say, anytime there is that many different options for managing something, as we
Yeah.
all know, what that means is
Yeah.
that none of them work.
Yeah.
Um,
Yeah.
you know, it really kind of how I manage them. It really just seemed to depend so much on how bad were they when they started.
Mm-hmm.
You know, because I would see those that have fairly minimal lesions that just really
Mm-hmm.
weren't that bad and they weren't that rapidly progressive. And I felt like some of those guys you could hold off with chlorambucil and prednisone and
Yeah.
whatever
Yeah.
else, and you're hopefully you're hopefully they'll live long enough that something else gets them in trouble before that does. And then you see those guys that come in with the great big plaques and they're
Oh.
starting to get lymph node enlargement, whatever else. And usually what I find, and you can correct me, if I'm wrong on this one, but more often than not, whenever I saw those cases, whenever you really started drilling the client with questions, is a lot of those dogs had lesions
Oh yeah.
or some type of dermatologic history that went back
Yeah.
oftentimes years.
And they're
That disease
usually misdiagnosed as a staph bacterial infection.
exactly, yeah, they
And they've
were
been
they
on 8 antibiotics. I totally agree with you. So really, they've had it for quite a while.
exactly, and it's
Yeah.
just finally,
Good
they
point.
have rolled to the point that now
Yeah.
they've gone into the plaque stage, or they've
Yeah.
started to develop like nodal lymphomas or whatever, and
Yeah.
and by that time, you are really really trying to push a chain uphill, to gain ground, you know.
Well,
So
now I have to quote you from one of our favorite people for your
I can
next
only
comment.
imagine.
Never trust a mast cell tumor.
Who would that be? Who would that be? Um, yes. And speaking of Guillermo, I talked to him right before I retired. So he is doing well. He's alive and well.
I hear he's a very
Traveling the
happy
world.
grandfather, Dr.
Yes,
Guillermo Cotto.
exactly,
We all
exactly.
know and love. And his words, I should have needle pointed him. I've always thought that. And when I would find, unfortunately, and we're going to talk about mast cell tumors now, a mast cell lesion in a dog, the first words that came out of my mouth to the owner was, we were taught we could never trust a mast cell tumor, which means anything I put your dog on works for some, but not for others. What's your feeling on that?
Yeah, to me, I think back to whenever I was very early in my career. The VCS mid-year meeting one year was about nothing but mast cell tumors.
Oh, wow.
And that just shows you how exciting we are. We sat around for 2.5 to 3 days talking about nothing but mast cell tumor cases, and I will never forget another one of my all-time favorite and influential people in my career was Dennis Macy. And Dennis had a slide that he popped up, and it was the quote from I can't remember which Dr. Seuss book it was,
Oh.
but it pops up, and it was which one of these is not like the other. I don't know why. Go ask your mother.
Boy, is that the truth.
And that is very very much the truth. I I was going through some of my old slides. This will date me a little bit. I actually still, when I was cleaning out my office, I actually still had books of 2x2
Two
Kodachrome.
by twos. Do not throw them out. I did, and now I regret it. Do not throw them out. Take it from me. Another retiree to retiree
But
opinion.
one of my slides was mast cell tumors. Was it a malignant killer of dogs, or was it much ado about nothing? And truthfully, I think both of those answers are correct.
Yeah, I
And
agree.
and the hard part is knowing which one you're dealing with when you
Yeah.
start.
Well,
Um,
shifty.
exactly. We see, the one good thing I can say is that I think we do so much better job now of being able to prognosticate on our mast cell tumors. Is this one that I need to worry about or not? Than we used to be able to. Um, Now that doesn't mean that we get it right all the time, but
Right.
I think that we do a lot better job than we ever used to, based off the, the two-tiered grading systems, and all the information that we get off of our path reports about mitotic counts, and if you really are, if you really are struggling, the prognostic panels that are offered, probably the best one is the one through Michigan State, and even then, you will, if you see enough of them, you are going to find one that does not do what you would expected it to do. But I think those pieces of information at least start to give you a little bit more clarity and a little bit more comfort as far as, is this something that I can send to surgery and monitor,
Right.
or is this something that we need to be like looking for stuff that it's got letters and numbers behind it, to throw something new at the problem, in terms of management. And we see all of these dogs that I think are just chronic offenders with low-grade mast cell tumors. And at some point, the owners get tired of cherry picking them off.
Yeah.
And I get asked all the time about what can we do from a medical standpoint to prevent further mast cell tumor development. That whole area of chemo prevention, essentially. And I have struggled with that one my whole
Do
career
you
because
believe in that? I mean,
I
never
have
thought about
I
that.
have had cases where I put them on, say something like chlorambucil or something
Okay.
along those lines, because, if you're kind of paying attention to what you're doing with that drug, it's unlikely that you're going to hurt anything.
Right.
But and I've had some of those dogs that they never developed another mast cell tumor, and I was sitting there going, well, is that because I put them on chlorambucil, or is that because that was just what they were going to do,
Yeah.
And then I've got others that it doesn't matter what I put them on, every time you turn around, they've got three new ones, and most of those are pit bulls.
Yes. Yeah. Yeah.
I was going to say, we used to laugh about boxers and pugs and all that type of stuff. And don't get me wrong, they still get it. But man, pit bulls have eclipsed any and everybody from a mast cell standpoint. And the bad thing about it is it seems like while they tend to get a lot of those multiple low-grade tumors, that type of thing, that are kind of more of an aggravation than they are a real problem. But then all of a sudden they may develop one that's like a hot grade 3.
Yeah. You can't predict it.
Yeah, it comes in looking like a tomato.
Yeah. Yeah.
And you're like, all right, well, the game just changed, so.
Way back in the day, Pat Breen and Gary Johnson, the pathologist, and I wrote up 2 cases of what we termed urticaria pigmentosa-like disease in 2 dogs. Urticaria pigmentosa in people are mast cells that when you do a Derriér's sign on them, in other words, you go like this, and then you get these lesions that pop up. And it's not uncommon in little kids, especially around the abdomen. Well, I had this black lab, probably about 6 years old, came in from Pittsburgh, and it would develop literally golf ball sized lesions that would come and go, that were full of edema and also other little nodules. The owner would go in the shower, take a shower, come out, the lesions would be gone. And when we biopsied them, they came back as mast cell, but they'd come and go and come and go and come and go. And we had a Cocker Spaniel, was our second case that we wrote up. This was in the AHA journal years ago. And we called it urticaria pigmentosa-like disease in the dog. Well, we didn't have all of the techniques that they're now looking at for grading back then.
Right.
So we put the dog on a combination of histamine 1 and histamine 2 blockers. Okay.
Right.
Something like famotidine and Benadryl. Well, the dog lived to 13 and died of kidney disease. So it wasn't, but see, there you would just suspect, oh my gosh, this is a horrible aggressive mast cell. He's getting all these nodules and these golf ball sized edema filled, but they would come and go. And so anyway, I agree with you, unpredictable for sure.
Oh yeah. I used to have just a sit down with my clients whenever I would see them, and I would say, if somebody tells you that they know what's going to happen with this case, they're lying.
Yeah.
I said I can tell you what I think is going to happen, but I refuse to write a warranty card for a dog with a mast cell tumor.
Boy, yes, and then Kodo's words come back to you. You never can trust them.
Yeah, they're gonna do what they're gonna do, and and they're probably going to do it regardless of what I do. It seems like, but as I said, I do feel like we've got better options for managing them now than we used to. And the the small molecule inhibitors, Palladia certainly has it kind of changed the game, and probably some of the most profound responses I've ever seen, in dogs with mast cell disease has been with Palladia, and to a lesser extent maybe with Gleevec or imatinib. Gleevec was the very first one of those small molecule inhibiting drugs in people, back in the 90s.
Right, right.
But it's come off patent now, and I mean, and
Oh.
you actually can get it compounded, actually fairly cheaply, in all considerations.
Thank God for that.
Yeah,
Because
exactly.
look at chlorambucil that
Oh yeah, exactly. That is the way
That's
to get it.
compounded for sure.
Exactly, because
Oh.
the brand name stuff is just crazy expensive.
I hate to sound like you and I are old, but I remember it used to
We
be
are.
$2 a tablet,
Oh yeah, 100%. Yeah.
and it's like $6,000 now. I just
It's-
did a talk on pemphigus in cats and chlorambucil, and when I pulled up GoodRx, I almost had a stroke when I saw the price of it.
Oh yeah, and like I said, to me that is one of the things that I try to kind of keep tabs on the whole compounding side of veterinary medicine, from a pharmaceutical standpoint, because
Sure.
if we don't have good compounding, we're going to quickly make it where we can't hardly do anything.
Right. Absolutely.
It's
I totally agree.
it's the only way to get some of these drugs, quite honestly.
Hey, anything new about hemangiosarcoma?
Anything new? Well, the one a couple of interesting things. Right now at Metro, we're participating in Ethos's push study.
Oh,
Which,
you are. I've been
yeah,
reading about that.
yeah, yeah. So we've been, so we're one of the study sites.
Okay.
And so basically dogs that come in for hemoabdomen, that do not have obvious evidence of metastatic disease,
Okay.
in liver or lung or anything along those lines. They ended up getting, they get some money towards their surgery,
Yeah.
in the histopath, and then if they are confirmed to be hemangiosarcoma, then they got randomized into different treatment groups. And so,
Okay.
just trying to determine, is what we've been doing, as long as I've been doing this, is that still the right way to handle it, or should we be handling
Yeah.
them differently?
Yeah.
And a lot of that's based, the treatment groups that got picked were kind of based off of some historical information about genetic mutations and that type of thing. But we're not necessarily tailoring it to the individual patient. They're just getting randomized to a treatment group.
Sure.
But it was treatment groups that kind of seemed to make sense based off of the information that we had.
And it's mostly large breed dogs you're seeing?
Mostly, yeah.
Yeah.
And so I'm going to be very curious to see, what comes of the final results of that study. Is that going to potentially start telling us that maybe we need to be looking at some of these other therapies? So it's not just, doxorubicin-based chemotherapy post-splenectomy, that type of thing. Should we be looking at some of these small molecule inhibitors, that type of thing in addition, et cetera, et cetera. So I think that that's probably one of the biggies. The other, the Yale vaccine study probably has had most of the attention that's come from that has actually been towards osteosarcoma, but they also were enrolling. They also were enrolling some hemangiosarcoma dogs in that study as well, which was one of the HER2. It was directed against HER2. So that is, I think, is another potential avenue. The just like on the human side, so much of therapy has kind of gone towards, kind of tailored medicine or personalized medicine,
Sure.
whatever terminology you want to use. Where they will genetically profile your tumor and that type of thing, looking for potential targets and are there drugs out there that potentially would fit in and be actionable. So I would say that I think we're still are kind of waiting to see the full potential of all of that. I think we're very much on the steep portion of the learning curve as far as learning how to dose a lot of those drugs, because most of those we're borrowing out of the human pipeline. We're not. We're
Scary.
not. Yeah, we're not. We're not. There's not a ton of drug development along those lines in veterinary medicine. Is slowly becoming more and more, but it's not like it is on the human side where there's thousands of those drugs. But the hard part is that a lot of times the pharmacokinetics may not have been worked out in dogs, or at the very least
Sure.
they were worked out in research dogs, not necessarily sick dogs. And what's the ideal dosing schedules, and we're learning. I think we're learning that we have more questions. I think it's the best way to put it. But I think those things are very exciting as far as
Yeah,
possible
I think
targets
more
for treatment.
questions is a good thing because it
It
promotes
is.
more interest and study into that.
For sure. Oh, for sure.
And for the viewers, I guess I should have mentioned hemangiosarcoma is a blood tumor that usually affects large breed dogs, spleen, liver, heart. It's one of those things that
In sub-Q, yeah.
and sub-Q. Oh yes, and
Skin.
my first dog had that, including sub-Q. We were walking to get the mail, and he just keeled over, and I'm like, oh my God, he's dead. This was before I was a vet, and in about a minute he got up and started walking again. And here it's one of these blood-filled tumors broke, and they get weak, and so. But then he ended up having the surgery, and it bought him 3 months. I mean, because he had all those sub-Q tumors after that. Yeah.
Yeah, it's that just an interesting little tangent. I got a lot of cases that were sent to me for dermal or sub-Q hemangiosarcomas, and the question I always ask whenever I would see those, or ask myself, I should say, is, is this the primary site?
Right. Yeah.
Is this the primary site? Because that's very different than if this is a metastatic site.
Yeah.
And it could be either.
Yeah.
You literally, ended up kind of working these guys up to the hilt just to make sure that, what you were dealing with wasn't the tip of the iceberg.
And we had on Dr. Ed Breichwart, and he's published where he's finding Bartonella in those tumors. Now, is that a cause or an effect? And
Right.
boy, when I read that, I got so excited because I've still been following hemangiosarcoma ever since I lost my first dog to it. You know how
Right.
that is. It kind of marks you for life. And to be honest, I haven't seen much in the way of anything great. So I thought, wow, wouldn't it be interesting if this Bartonella organism, which is the cat scratch fever organism, was playing a role in this?
Right. Yeah. And it's another one of those tumors, like kind of like the whole oral squame thing in cats.
Yeah.
It's one of those things that I think that survival statistics to me look better for hemangiosarcoma dogs, for some
Yeah.
hemangiosarcoma dogs, than they used to. I think because of the therapies that are out there now, kind of in addition to what we've been doing. Kind of if you want to use the term standard of care, which I'm not sure if there is, but
Whatever that is anymore.
whatever that is,
Yeah.
yeah, usually doxorubicin-based chemotherapy in addition to surgery. But it's been one of those things that the advances that we've made have been small and slow in coming, I guess is the best way to put it. It's just one of those just tough tumors. And I think it will continue to be for a while. And also I think one of the other things is it's a tumor that its reputation kind of precedes itself. With a lot of clients, and so whenever you start talking to people about it, and unfortunately they usually are trying to make decisions in a really bad time frame because it's something got forced on them.
Yeah.
Their dog was fine, a half an hour ago and now it's not, type of thing. I think, they either had a friend or something else, 10, 15 years ago, that their dog had this, and, they did all this stuff and the dog was dead in a month and a half,
Yeah.
And obviously those are big hurdles that you have to overcome before you can really start to treat aggressively.
And again, misinformation,
Yeah, and I don't know if it's necessarily sometimes misinformation as much as it is it's overwhelming information coming very rapidly at people.
True.
And-
Because it's shocking you're getting this news. The dog was fine in the morning. He keeled over 2 hours ago, and now it's cancer. And yeah,
Yeah, exactly. And so people are, you're asking them to make big decisions in a really, really bad
yeah.
setting, So it
And I
happens.
have to ask you, lastly, I'm going to ask you about lymphoma and
Yeah.
what's going on with that. Is there any light at the end of the tunnel for lymphoma dogs?
Well, I definitely think there's some interesting things going on. I know that also, I know since I've left Metro, I know Ethos has started actually a lymphoma study. So there actually is a funded lymphoma study going on at Metro right now. So put in a little plug. Put a little plug.
Yay.
For them.
And he's talking about Metropolitan Veterinary Hospital in Copley, Ohio.
Yeah, in Highland
Our
Heights.
favorite. My personal favorite.
Yeah. So the I think really I think the big thing is that we talk about lymphoma so much like it is a disease, and it really isn't. It's really a huge umbrella of a disease, and no two lymphomas are exactly alike. And I really think we're starting to see the value in trying to subcategorize these a little bit better. We've known for a while, that there were big differences in is it a small cell lymphoma or a large cell lymphoma, that type of business. Now with things like immunophenotyping, is it a B cell lymphoma or a T cell lymphoma? We know that may have some significant prognostic bearing in terms of response, drug sensitivity, drug responsiveness, all that business. And so I think it's becoming probably more. I can remember, 25 years ago, while I found T versus B cell to be academically interesting, it didn't really change what I did.
Yeah, yeah. Right.
Type of a thing. Whereas now, I would actually potentially treat very differently. Just because we've learned, that some drugs don't work as well as others in, say in T cell lymphoma, that type of thing. And so we start to kind of tailor more to the patient, and I think all of those are kind of hopefully moving us in the right direction. In people, probably the biggest thing that changed the survival for people with non-Hodgkin's lymphoma was a drug called rituximab, which was targets the CD20, the CD20 molecule on the receptor of B cells, and any attempt that we have made on the veterinary side to specifically target, say, CD20 or CD21 or CD3 and T cell lymphomas, et cetera. Unfortunately, we have really struggled to come up with something that works the same, but works nearly as well as rituximab. But I think if we are able to find something that works down that pathway, then hopefully we'll do a lot better.
And I know we've talked about this before when you were on earlier. Our pet parents need to know that the goal of chemotherapy in veterinary medicine is different than in human medicine. We're focusing on quality of life.
For sure. In people, I think so much of the illness that we see associated with people and chemotherapy is that they are pushing us really hard to try to cure us. And we know, unfortunately, with most of our chemotherapy regimens and most of the diseases that we're treating, is that we're probably unlikely to cure in a medical standpoint in veterinary medicine. There are some exceptions. But I think we are probably using chemotherapy more the MD oncologist would say basically we're using chemotherapy as a palliative measure, probably as much as anything, kind of palliative chemotherapy. But it certainly appears to improve survival. And I think there is, as much as I hate to say it, I think there's a lot more emphasis on quality of life issues in veterinary medicine than there is in human. And most of our clients are just not going to put up with their dog being as sick as
sure,
as we are, say on chemotherapy. And I've always kind of tried to strive to treat the disease as aggressively as I could get away with a reasonable level of complications. Having our appetite being off for a day or so, or maybe about a soft stool or something along those lines, but the other 6 days of the weeks were great. I can live with that. If you turn it around and we've got one good day of the week,
yeah, that's right.
I think we really need to think about what we're doing.
I remember when my dad, who had cancer of the appendix that then hooked onto the colon, and after his surgery, which bought him 3 years, he said to me, Al, it went to his liver then, and he said, Al, what do you think I should do? They want to do chemo. And I said, you know what, Dad? Let's do it, but if for 2 minutes you don't feel good, then we're done. And he did great. He did great. He had a little bit of sores in his mouth occasionally, but it was nice that it didn't devastate him, which is sad. And I know our goal in veterinary medicine is, hey, let's keep them eating and happy and running. And like you said, if they go off their food for a day, hey, I'd like to go off my food for a day, just to be honest with you.
In fact, I probably could stand maybe more than a day, quite honestly.
I know. Hey, one more thing before we go. I just thought of it. Anything new for bladder tumors?
Anything new for bladder tumors? There on the nutraceutical side, some of I know Nutramax has brought out, and this is if I had it right in front of me, the name is escaping me right in front of me, but it's one of the broccoli extracts.
Oh yes. I had ordered that for my Skeeter. Skeeter Marie had bladder tumor, and I ordered it before it was available in veterinary. I ordered it from Life Extension.
Right.
Yeah. Okay.
Right. So so there's that.
Sulforphane. I can't. SULFORPHANE.
There you go.
Ingredient. Yeah. That's not the name of the. That's the active ingredient. That's
the active ingredient. Yeah.
Oh, I love that they're making that.
Yeah. So that's out there now. Probably the biggest thing probably has more to, in my mind, has more to do with on the diagnostic side.
Okay.
The BRAF testing, which is available basically you can basically test on caught urine samples, allows us to basically pick up genetic mutations, genetic mutations actually in the urine, which has been nice if you have a suspicious lesion on ultrasound or whatever else. Used to be, what we ended up doing was, cystoscoping and biopsying and that type of stuff, to get answers. Now with a caught urine sample, we actually have a test that's got really high sensitivity and specificity for the disease. And so that actually has been really nice from a diagnostic standpoint.
Oh, that's good.
Yeah, I mean, I don't know that it is necessarily, 100% foolproof.
Yeah.
But it certainly has made it a lot easier for us to answer questions for clients. Is this bladder cancer or not, or what's our index of suspicion?
And what a nice non-invasive test. I mean,
Right.
It's easy to pee in a cup as opposed to open the dog up to biopsy whatever's in there.
Right. Exactly.
Thank God for that.
Yeah. So it's become, I would say, I don't know if I would say it's necessarily uniformly accepted across the board to be, the way to diagnose it. But I tell you what, it sure increases. It's another piece of information that if you've got a negative, you start to feel a lot better that it probably isn't a bladder tumor.
It's pretty easy to get pets to pee in a cup.
Yeah,
I mean,
it is.
There are a lot of contraptions that we could probably take pictures of the clients,
They're very ingenious. Yeah, exactly.
Right. Well, on that note, thanks so much for being here. And thanks for introducing us to the new member of the family.
Thank you.
I wish you a lot of luck. My advice to you, I already gave you 2 suggestions for retirement. My third is, once you get to be our age, having a young dog around is a lot of work.
Oh my gosh. Yeah, that has definitely been the challenge,
Yes.
essentially having a newborn back in the house.
Yes.
I've spent a couple of nights sleeping on the floor and that type of thing, but
I think your beard got a
it's
little
work.
whiter since I've seen you with this new pup.
Yeah, but he's, like I say, I've got my fingers crossed he's gonna be like his daddy.
Oh yeah, and his daddy's how old?
8.5. 8.5. So
Wow.
and my old guy's still around too. He just turned 15.
He just had a birthday.
Yeah,
I
he
saw on
turned 15,
Facebook.
Yeah,
Yeah, give him a kiss
in
for
April.
me. And give
I will.
Tracy a hug too.
Exactly, will do.
All right,
Will
well,
do.
this is Dr. Alice Novotny Jeroman and Dr. Rance Gamblin signing off. Please tune in, like us, support us. We love you. We're here for good information. Oh, my 2 Goldens are here now. We're here with good evidence-based information for your pets, and hope they stay healthy. Thanks, everyone. Bye-bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you
good.
could both go bye-bye.
Bye-bye.
Well, yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.